I can start by answering that question of why I did MD, MPH. I know Heather and I had actually been talking about it for quite a long time while we were applying and like seeing if we wanted to do it. We were kind of going back and forth. And what ended up for me being one of the major factors and contributors to me actually doing it was hearing about the practice experience, and I'm sure a lot of people will be talking about that. I really enjoyed the idea of being able to do something that was really meaningful to me, finding an organization that I would be passionate about, like working with, and then working within that community. And I think public health research has always been of major interest to me. I would do a lot of service in the community, whether it was during undergrad or anything before that as well. So the MPH kind of was just like an extension of that work and wanting to do more service that was meaningful to the community and impactful. So I'm hoping to one day be in cardiology, and a lot of my public health research interest is in heart health. So with the practice experience, I'll be able to work with the American Heart Association this summer and start that journey of what it looks like doing public health research while also pursuing an MD.
For me, I decided to do this because I was thinking about like for a long time how like medicine is supposed to be people centered, and a lot of times it is, but a lot of times it can sometimes get caught up in the clinical aspect and just diagnosing and treating and hospital life and all of that. But what I liked about public health is it really brings it back to like the patients and the communities you're working in, and like how really to help them, and that's what I think is like the center of public health. So it's less of like one person, but more of population based and how you can change communities and influence them to maybe make better choices overall, rather than and like taking into account things that maybe traditional like clinical medicine doesn't always put at the forefront of practice, things like access to care, things patient patient eligibility and things like that. And so for me, I wanted to do public health because I felt like it brought it back to, the reason why we're all doing this. So it's like patient centered. So, and I also like the idea of maybe being in like a group of with a group of people, like a smaller group of people that I could talk about these interests with. I know a lot of my classes now are discussion based, so it feels nice versus just traditional like lecture where you just just try and digest lots of information. So that's one of the reasons I chose this.